A warm thank you to our amazing auxiliary for creating this important and timely video. Their devotion to supporting our behavioral health services is especially meaningful as the COVID-19 pandemic has magnified how stress can wreak havoc on mental health, especially for children and young adults. We are social beings who love to get together to see and hug those close to us. COVID-19 has shattered our regular routines and means of socialization. Many people now work at home. For many children, school is at home as well. Play dates, birthday parties, prom, plays, athletic competitions, and so many rituals of our youth are not happening. Not to mention the isolation caused by the lack of social interaction in their lives. And of course, for adults, the story is much the same. No movies, no dinners out, or vacations and holidays spent with family and friends. A recent study performed by the Centers for Disease Control and Prevention confirmed what we see in healthcare every day. People are stressed. More than 40% of the 5,000 plus respondents reported having issues, including anxiety, depression, new or increased substance use, or thoughts of suicide, a significant increase over 2019. Regarding children, CDC investigators also studied data from a National Emergency Room surveillance database from January through mid-October. The results were bleak. Emergency department visits related to mental health increased 24% for children ages 5 to 11 and spiked 31% among adolescents ages 12 to 17, compared to the same period in the previous year. The entire healthcare system is sagging under the weight of this sudden increased need for mental health services. At Emerson, we have seen the impact in our emergency department and beyond. Trying to get an appointment for a teenager with an outpatient psychiatrist, psychologist, or social worker is almost impossible. As a nurse by training, what is heartbreaking for me during this mental health crisis is knowing that behavioral health issues have historically been undervalued. Insurance companies typically reimburse medical and surgical care far more than behavioral health care. I am heartened by President Biden's proposal to create parity in mental health coverage across the country. Massachusetts passed a mental health parity law in 2000, which equalized benefits for mental and physical health, but not before many hospitals closed their inpatient behavioral health units. I am proud that Emerson has maintained its inpatient behavioral health unit and also provides outpatient addiction recovery programs that are important to caring for our community. When a child enters our emergency department with a mental health or behavioral health issue, such as depression, violence, self-harm, and suicide attempts, often as young as 6 years old, we evaluate them to provide the best possible care while connecting and locating a pediatric facility for them. Our pediatric intervention team plays a critical role in helping us to support the child and their family. Because there are so few mental health beds in Massachusetts, Emerson's emergency department and hospitals throughout the state are often forced to keep patients in a space not properly designed for behavioral health care and not conducive to patient and staff safety. So why am I painting this dim picture? Because as a parent, a nurse, and a hospital leader, I do not want the seriousness of our mental health crisis to be forgotten amidst the growing optimism the COVID-19 vaccine has offered. Unfortunately, the devastating impact of COVID-19 will not go away with 1 or 2 shots in the arm. I believe with a fair degree of certainty, the mental health effects of COVID-19 will linger long after this dreadful pandemic is just a memory. That is why the auxiliary's mission of supporting behavioral health is so important. Let's work together to fight against the behavioral health pandemic in the same way that we fight against the COVID-19 pandemic. Let us provide our community the mental and emotional personal protective equipment that will help prevent hospitalizations that could further impact the mental health crisis. Emerson is here to help care for everyone in our community. I hope by supporting this important cause, you can be there for us too.